Hello, everyone, and welcome back for the lecture on Chapter 23. This will continue our discussion on microbial pathogens that cause diseases in humans, in particular on the urogenital system. We'll need a basic understanding of human anatomy regions. First, we'll talk about the urinary system. And we can see here, if we trace it at the start here, we have a pair of kidneys and a pair of ureters that filter waste products from the blood and flushes those waste products from the body in the form of urine down towards what we have as just a single bladder and urethra. Here is a depiction of the female reproductive system. This includes a pair of ovaries that produce eggs or ova and releases them during ovulation. The uterine tube, also called the fallopian tube, transports the ovulated eggs from the ovary to the uterus. If sperm is present, fertilization typically occurs there. And the uterus is a muscular organ where a fertilized egg implants and develops into a fetus during pregnancy. The endometrium is the inner lining of the uterus. It thickens each cycle in preparation for implantation. If no pregnancy occurs, then it is shed during menstruation. The cervix is the lower, narrow portion of the uterus that opens into the vagina. Cervix actually means neck, so that's kind of the appearance that region takes is as a narrow opening. It produces mucus that changes consistency throughout the menstrual cycle, and this aids in inhibiting sperm passage during certain times. And the vagina is a muscular canal, and that connects the cervix to the external body. It functions in childbirth, sexual intercourse, and also menstrual flow. And here is a depiction of the male reproductive system. The kidneys are not shown in this picture, but they filter blood and produce urine, which drains into the ureters. The ureters transport that urine from the kidneys to the urinary bladder, where it is stored until it's expelled. The urinary bladder, it's located just above the prostate, and it temporarily holds the urine. The urine exits the bladder through the urethra, which passes through the prostate gland and extends through the penis to discharge urine. The testes produce sperm, and during ejaculation, sperm travels through the ductus vas deferens, which ascends towards the bladder, and the prostate gland contributes fluids to semen. The ductus deferens then passes through the prostate gland, where additional fluids are added, and the urethra serves as a dual function in males, carrying both urine and semen, of course, not simultaneously. Now, I just wanted to remind us that there are normal microbiota that inhabits the surfaces of our body, and this is true for the urinary system as well. It's not a sterile environment. There are microbes there as well. Not all of them are completely understood, but there's estimated to be many dozens of species there. In women, this microbiome is closely related to the reproductive system and includes, in particular, lactobacillus. The vagina is primarily colonized by lactobacilli, and they, as we know, they are really good at fermenting and making lactic acid, amongst some other acids, and that helps maintain an acidic pH, which is inhibitory to many microbial species. We saw that when we looked at the skin, for example. In this normal microbiota, just like with our genital tracts, it is going to be involved in our first line of defense from pathogens. So it helps to competitively exclude those pathogens. They produce compounds that inhibit the growth of other microbes, and they actually promote our healthy immune system. There are three diseases of the urinary system we'll discuss: cystitis, pyelonephritis, and leptospirosis. Cystitis is inflammation of the bladder. Usually, this is caused by a bacterial infection. The most common cause is just Escherichia coli or E. coli. This is a bacterium that's normally found in the intestines. Another possible cause is Staphylococcus saprophyticus, which is more common in sexually active women. And cystitis is far more common in females than in males. And this is because the female urethra is shorter, making it easier for bacteria to traverse the urethra and reach the bladder. In men, bladder infections are rare and usually linked to some other underlying condition. Symptoms include dysuria, that means pain and difficult urination, or pyuria, which means pus is present in the urine. Diagnosis is confirmed with a urine culture, and if the sample contains more than 1,000 CFUs per milliliter, that's colony forming units, this indicates an infection. Doctors also use a leukocyte esterase test, which detects an enzyme found in neutrophils, part of our white blood cell suite. And this is used to confirm the immune system is responding to an infection, typically bacteria. When white blood cells are present in urine due to an infection or inflammation, they release a enzyme called leukocyte esterase. And a urine dipstick test contains a reagent pad that reacts with leukocyte esterase, producing a color change that indicates the presence of WBCs. Pyelonephritis is a kidney infection. This develops when cystitis or a bladder infection goes untreated and it works its way up the ladder, so to speak, towards the kidneys. So instead of staying there in the bladder, the bacteria travel and infect one or both kidneys up the ureters. Symptoms include fever, side or back pain, nausea, vomiting. If left untreated, it can cause permanent kidney damage or even sepsis and can be fatal. Symptoms excuse me, the most common cause here again is E. coli. It's responsible for about 75% of the cases. This is the same bacteria, of course, that is typically involved in urinary tract infections. Diagnosis is confirmed through a urine culture where doctors look for bacterial growth, um, but a much higher number of bacteria, which is indicative of a more intensive infection. So we're looking for 100,000 CFUs per milliliter of urine. Leptospirosis is caused by Leptospira interrogans. This is a spirochete, as you can see in the image, a type of bacteria with a tightly wound spiral shape, and that helps it move through tissues and fluids. This is found mostly in tropical or subtropical environments, and it spreads through contact with contaminated water, usually from animal urine, especially in places with poor sanitation or after heavy rainfall. People can get infected by drinking, swimming, or even walking through contaminated water with open cuts or mucous membrane exposure. Symptoms start with a headache, muscle aches, fever, and chills lasting a few days before easing. Some people feel fine for a bit, only to have some symptoms return later. However, in rare cases, the infection can worsen, and this leads to something called Weil's disease, where it attacks the kidney and liver, can cause kidney failure, jaundice, and internal bleeding. While most recover without complications, severe cases will need hospitalization and or antibiotics. The types of infections that occur on the reproductive system are more numerous, and so we're going to spend most of our time talking about these, from bacterial to viral to fungal and protozoan pathogens. We'll begin here at the top of the list with the bacterial pathogens, and we'll start with gonorrhea, which is a sexually transmitted disease caused by the bacteria Neisseria gonorrhoeae, and is is transmitted differently based upon the sex. So this organism can infect many sites, including the eyes, rectum, mouth, pharynx, or genitals. Adolescents and young adults aged 15 to 24 are actually more disproportionately affected by gonorrhea, and they make up over half of the reported cases. For men, as I said, it's differentiated the infection rates by sex. For men, the chance of getting infected after a single exposure is about 20 to 35% when symptoms appear. They usually involve painful urination and pus-filled discharge from the urethra. For women, the transmission rate is much higher, 60 to 90% per exposure. Unlike men, gonorrhea in women infects the cervix and can have few or no symptoms, which makes it easy to miss. However, when symptoms do show up, they may be mild, like slight discomfort or increased vaginal discharge. The problem is because women often don't realize they have it, untreated infections can lead to serious complications later on. We're talking about pelvic inflammatory disease, infertility, or ectopic pregnancy. And this is why proper measurements to avoid exposure, as well as early detection and treatment, are critical in treating gonorrhea and making sure that this doesn't occur. If left untreated, it doesn't just stay in one place. It can spread throughout the bloodstream. It can infect the heart, brain, eyes, and joints, leading to serious complications. Unlike some infections, gonorrhea doesn't trigger lasting immunity, meaning you can get it over and over again, even after being treated. Diagnosis depends on the patient. Um, men, it's usually just a gram stain of urethral discharge. If you look on this stain here, I want you to be able to determine if that is a gram positive or gram negative stain. And so we're looking for these organisms that are stained light pink and diplococci inside white blood cells. In women, gram stains are not as reliable due to the different microbiota that inhabit the region. And so doctors use selective culture media or molecular tests to confirm the infection. Um, Now, something it has a lot of scientists are sounding an alarm for is that these bacterium are actually becoming untreatable with antibiotics. And that is creating quite a problem due to some of those severe complications I spoke of earlier. We also have non-gonococcal urethritis, or sometimes just called NGU. This is also inflammation of the urethra that isn't caused by Neisseria gonorrhoeae. The most common cause is Chlamydia trachomatis, a bacteria that can infect the genitals and the eyes. In men, symptoms are usually mild if they appear at all. Up to 50% of infected men don't even realize that they have it. When symptoms do show up, they may include discomfort while urinating and a clear white discharge. However, in women, the infection is even harder to detect. As many as 70% of cases are completely asymptomatic. That means many women don't even know they're infected, which increases the risk of long-term complications like pelvic inflammatory disease. Pelvic inflammatory disease, or PID, is a broad term for infections of the female reproductive organs, including the uterus, cervix, and ovaries. The most common causes are Neisseria gonorrhoeae and Chlamydia trachomatis, the same bacteria responsible for gonorrhea and chlamydia. If these infections go untreated, they can move upward into the reproductive tract, leading to PID. The most severe form of PID is salpingitis. This is an infection of the fallopian tubes. This can cause scarring, which blocks the tubes and may lead to infertility. One of the biggest risks of PID is ectopic pregnancy, where a fertilized egg implants outside of the uterus, usually in the fallopian tube. Because the tube can't support a pregnancy, this can be life-threatening if not treated immediately. Next is syphilis. This is caused by a tightly coiled spirochete called Treponema pallidum. Uh, it can be from genital mucous membranes. It can then enter the blood and invade other body tissues. Syphilis progresses through distinct phases, each with characteristic symptoms. The primary stage is approximately 2 to 12 weeks after exposure. A small, painless sore called a canker appears on the infection site, such as the genitals, anus, or mouth. This sore heals on its own within a few weeks, but without treatment, the infection advances. Secondary stage, where after the canker heals, a non-itchy rash develops often on the palms and soles. Other symptoms include fever, sore throat, swollen lymph nodes, and patchy hair loss. These signs may resolve without treatment, yet the disease can persist. Latent stage is a phase where there's no symptoms and it can last for years despite the absence of signs. The bacteria is still in the body, progressing to severe complications. And then finally, we have the tertiary stage. If untreated, syphilis can advance to this stage, and this causes serious health issues, including with the heart, the brain, and other organs. This graph shows syphilis rates in the US from 1941 to 2018. It's broken down by total syphilis cases, which is the more pronounced gray line here. Early non-primary, non-secondary syphilis is brown, and primary and secondary syphilis is blue. At the bottom, you can see the rate is measured per 100,000 people. And you can notice some clear trends here. First, in the 1940s and 50s, there was a sharp decline in the total syphilis cases. This decline coincides with penicillin. Antibiotics become widely available for treatment for syphilis. And we see in the 1950s through 1990s, after the steep decline, total syphilis rates remained relatively low and stable throughout these decades. However, starting in about the 2000s, syphilis rates are gradually beginning to rise again. Both early non-primary, non-secondary syphilis and primary and secondary syphilis have increased since the mid-2000s, indicating that we're getting a resurgence of this type of infection. The next disease on our list is bacterial vaginosis. This is an inflammation of the vagina caused by an overgrowth of Gardnerella vaginalis. It occurs when the normal vaginal microbiota, particularly lactobacillus, is disrupted. Symptoms include a vaginal pH greater than 4.5 due to the disruption of lactobacillus. An odor and thin grayish-white discharge does occur. And under a microscope, there are cells that are called clue cells. These are actually the vaginal cells covered in bacteria. And this is an important part of the diagnosis. They're called clue cells just because they serve as a clue that a patient may be experiencing bacterial vaginosis. It may result, there's some more research that needs to be done on this. It may result just from sexual transmission of G. vaginalis, or maybe it's just a consequence of the normal lactobacillus bacteria in the vagina decreasing, allowing the pathogen to overgrow. Now we're going to move from bacterial diseases to viral diseases. We have just two that we want to talk about here, herpes and genital warts. Herpes is caused by the retroviruses called herpes simplex virus types 1 and type 2, or HSV1 and HSV2. HSV1 is mostly associated with oral herpes, while HSV2 is the primary cause of genital herpes. although it's important to keep in mind that these two viruses can infect either of those two regions. Estimates do vary, but a common number there is that about 1 in 4 people are infected with HSV2, and about 50% of the population of adults are infected with HSV1. And the reason why these numbers are surprisingly high is because most people don't know that they have it because they don't show symptoms. Symptoms can include a burning sensation, painful lesions that then progress into fluid-filled vesicles. Then these deflate or they release their fluid and then they resolve themselves. These sores can make urination painful, and even contact with clothing can be painful. Once infected, the virus stays in the body for life. That's because it's a retrovirus. So these viruses, they hide, quote unquote, in nerve cells where it can reactivate later. About 90% of people with HSV2 and about 50% with HSV1 do experience recurring outbreaks. There's no cure. But there are antiviral drugs like acyclovir that can reduce symptoms, shorten the outbreaks, and lower the chance of recurrence. Interestingly, there are some attempts to use gene editing technology to actually cure someone of herpes, particularly a gene editing tool some of you may hear in the news called CRISPR-Cas9. This actually offers a potential breakthrough in herpes simplex virus treatment. Again, it's a retrovirus that integrates its genome into the host cell's chromosomes, and so it remains there for life. And there are certain conditions that activate that virus, and then that's what causes this secondary infection to, or a recurrence of the infection to occur, kind of how smallpox or chickenpox and shingles works. Unlike antiviral drugs that only inhibit the replication of the virus once a infection has recurred, CRISPR is a gene editing tool that can target and cut the viral DNA that's embedded within the human chromosomes. And so the idea is that it locates the HSV's genetic material based upon its specific genetic sequence. The CRISPR disrupts its ability to persist there and basically makes modifications to the genetic code that renders it inactive. Researchers have demonstrated this in animal models for reducing or even eliminating the latent virus in the bodies. However, there's a lot of challenges that remain. A big one is trying to deliver this to all of the infected cells. And the safety of it is not quite proven out either, because when you start cutting at the chromosomes there, you have the possibility of having non-specific cutting. So it cuts where it's not supposed to, and then makes changes to the genome where it wasn't, or the chromosome where it shouldn't have. Despite these major challenges, it's a potential big shift in being able to treat retroviruses, which give us persistent viral infections quite often. And I will just say that this is only in preclinical trials, so we're at least probably I'll just say many years from this actually entering into the market, if things go well. Neonatal herpes is a serious infection that occurs when a baby is exposed to herpes simplex virus before or during birth. HSV can cross the placenta, meaning if a pregnant person has an active infection, the virus can reach the fetus, and this can lead to spontaneous abortion, premature birth, severe neurological damage in the baby, so on and so forth. If neonatal herpes goes untreated, the survival rate is only 40%. Usually that's not the case, though. The virus can spread through the infant's body, and it can cause organ failure, brain damage, or death. The most common way newborns get herpes is actually during delivery. where it's passed on from a mother who has active sores, and then the virus enters the baby's eye, skin, or mouth and can spread. If a pregnant person has genital herpes, um, usually what's prescribed is antiviral medication throughout towards the end of pregnancy. And also, a C section may be recommended if there are active sores present at birth. Early detection and treatment with antiviral drugs improves survival and long term health outcomes. Genital warts are growths on the skin and mucous membranes caused by human papillomavirus. It gets its name because the warts that it causes are called papillomas. They are one of the most common sexually transmitted diseases. The size and the appearance of the warts vary depending on the HPV serotype. Some are raised, some are flat or clustered together, while several of them are so small they just go unnoticed. In most cases, the body's immune system clears the infection within a couple of years, meaning the warts can just resolve on their own. However, not all HPV types are resolvable or just cause warts. In particular, serotypes 16 and 18 are of a high concern. They are high risk strains and they don't usually cause visible growths, but they're linked to cervical, oral, anal, and penile cancers. Because of this cancer risk, HPV vaccination is an important preventative measure. Now, there's one disease of the reproductive system with fungi that we're going to talk about, and that's candidiasis. This is a opportunistic infection of the vagina by members of Candida, most often Candida albicans, which is just a part of the normal microbiome of the mouth, intestines, and vagina. So you probably know where we're going here. This comes about due to typically an antibiotic therapy treatment, or maybe people have something like diabetes or they're immunocompromised and that predisposes them to getting this infection. Now, it is accompanied by itching and a thick discharge, but this discharge is typically yellow in appearance, and you don't really get as much of an odor as we looked at with some of those bacterial infections. Okay, lastly is a protozoan infection, trichomoniasis. This disease is caused by the protozoan Trichomonas vaginalis, which is a motile protozoan parasite. You can see it in the image here on the right. It's transmitted through sexual contact. So there's no cyst stage where it survives in between hosts. And so that is why it requires direct transfer to occur. Symptoms are typically asymptomatic, but it can cause itching, burning, discharge, and which may be a green, sort of frothy or yellow color, and discomfort during urination or sex. It can lead to an increased risk of other STIs due to the infection, including HIV and pregnancy complications like preterm births. Treatment for trichomoniasis is pretty straightforward. A couple antibiotics that can be used here are metronidazole or tinidazole, but to prevent reinfection, both partners should be treated. And that wraps up our discussion of diseases of the urogenital tract. Thank you so much for joining me, and we'll see you in the next chapter.